的医生演讲环节。那么我要把主持棒交给的是这位博士呢，还没有看到他的人，就会先听到他的笑声。那他爽朗的笑声呢，就立刻温暖了我们整个房间。他就是刘淑明博士。刘淑明博士呢，他毕业于瑞典李雪平医学院，20多年来一直积极举办讲座，推广癌症的知识。现在是我们新希望的理事会员，同时担任新希望开启署名有约的专家访谈系列讲座，以专业知识、严谨的思维、幽默的语言，伴随大家穿越癌症预防检测台湾的神秘事件。寻觅希望，笑谈癌症。我们现在就欢迎刘博士出场。
谢谢万乐泉。谢谢大家。当万乐泉那个美女说还要先给我介绍一番，我就觉得很奇怪，我还需要介绍吗？大家都知道我是新希望来的，然后我觉得看见我就看见了新希望。为什么这样说呢？我这么美丽，这么年轻，拿了一个拐杖，是为什么呢？我20多年前就得了癌症，然后复发了2次。那2个月前。全身骨骼转移了，所以这个拐杖呢，只是为了帮助我不要摔倒，你们不要怕哈。大声的笑几下不会把我吓到的。那我觉得今天很荣幸，我们请到了2位真的是专家级别的医生来给我们做讲座。那我们第一位讲员呢是 Dr. Velotta， 那他呢是对亚裔非吸烟的女性肺癌发生率越来越高的这个现象，做了很多的 research， 然后呢给我们做了一些图表呀、一些 table 啊，告诉我们这是一个令人担忧的一件事情。但是呢，他的讲座呢应该还会告诉我们不要那么担忧，我们还是有办法的。所以他是Kaiser Permanente Oakland 的thoracic surgeon and also associate professor of UCSF。所以 title 不是很重要，我就觉得这些医生能腾出时间来为我们讲他最新的研究这个结果，讲他这个想法，我觉得这一些是我非常佩服的，医生能做这些事情。好，那么我们就请 Dr. Velotta welcome。I just give them a short introduction about you. I think they all understand. If you have anything you want to add it to, then welcome.
Okay, thank you so much. Okay, next please. Okay, so thank you for the warm introduction, and you all have been so great to me ever since I met you in May. So thank you to the team. It's in May at Stanford, our talk on lung cancer in Asian never smokers. So it's really been a privilege, and I'm really grateful and almost like overwhelmed at the support that you guys have provided us. So I'll get right into it because I only have 20 minutes, and hopefully this will be meaningful for you all, or something, whether it's new or old. I'm hoping to give something back to you all that we can figure out how to stop this, or how to catch this earlier. And what we're going to talk about, right, so I'm a lung cancer surgeon, thoracic surgeon, but these are the patients, right? You all know, I'm sure a lot of you are patients as well, or family members. I have a family member, my grandfather died of lung cancer. My dad died of heart disease, and they've all had surgery, so I kind of came into that field. But this is a patient of mine, Christy Chan, and this is what we're seeing. This is her in the middle, and this is, and she's no longer with us. And so this is just one of the examples of the lung cancer that's affecting our younger women, and I just always like to start off with a patient, whether it's her or so many others. Unfortunately, I can use multiple of these images with multiple different patients, and we want this to change. Next slide, please. All right, so I'm gonna start with a video, and hopefully this will bring it home. This just came out 2 weeks ago, and hopefully this will bring some context. So we can go ahead and play the video. Thank you. Hi, my name is Dr. Jeff Velotta, and this is my brief but impactful story. When I returned to the Bay Area from Boston in 2014, we were finding many Asian women, particularly whether smoking or not smoking, were getting lung cancer, and we were seeing them often too late. And that was the issue. I was catching some early, but a lot we weren't. And I thought, this is something that we have to really change.
My name is Susan Brown. I'm an emergency room doctor at Kaiser San Francisco, a mom of 3, and a non-smoker. I was 37 when I was diagnosed with lung cancer. I had this chest pain that just wouldn't go away. At first, the x-rays looked normal, but eventually a CT scan showed a mass, and a biopsy confirmed it was cancer. I had surgery to remove half of my lung, and I'm so grateful it was caught early enough to treat. When I met Dr. Velotta, he was the first physician who wasn't surprised. And he told me he was seeing more and more cases like mine.
So we're able to look, over the last 10 to 15 years, non-smoker Asian women were getting lung cancer at an increased incidence, 2% per year. Then we knew there was something that we needed to do. In addition, we also found that in our population of all the patients that got lung cancer within the last 10 years, the majority of Asian patients, Asian women, were being diagnosed at stage 4 and not early stage. And they were being diagnosed more at the age of less than 50. So clearly there's something else that we had to do to make a difference. And while that was unfolding, I also saw something else. Our Asian American men and women that actually do have a smoking history, they actually do qualify for standard lung cancer screening guidelines, but they had no idea that they could get screened. They had no awareness, our providers didn't know, our patients didn't know, but they did qualify. And what was the issue? I mean, really it was cultural, it was language, it was just a system that wasn't gonna necessarily help them along. They needed that TLC.
Hi, my name is Nancy Fong. I've been in Kaiser Permanente Oakland for many years. I smoked for most of my life, about 50 years, more than a pack a day. I never thought about lung cancer screening. It's not something I would have asked about. It just so happened last year, someone had reached out to me, and I remember during my visit, my doctor said, let's do a scan, let's do an x-ray. And that's when they found it, early stage lung cancer. I feel really lucky it was caught when it was. I think about how different things could have been if no one had reached out to get me in. Sometimes care has to find you, because it really can make all the difference.
So really the key for us was that it was 2 separate groups, but 2 very affected groups. We had Asian women, non-smokers, with an increased incidence of lung cancer that were not being addressed. And then we had another group that we already have a lung cancer screening CT scan for, Asian men and women that do have a smoking history. Both of them were not getting screened, whether they didn't qualify or they just didn't know about it. So it was really a systemic issue that we had, and how do we fix that? 33% of our Bay Area population are Asian American. So we got funding for a program, a lay navigator program. A lay person doesn't necessarily have to have a medical background. They'll go out and outreach our patients that qualify for lung cancer screening. And we already knew that our Asian Americans were high risk getting under-screened. So we focused on 500 Asian American men and women with a smoking history. We literally called them in to come in for their lung cancer screening CT scan, and the majority of them did not even know they qualified. We instructed them how to do it, and they got in for their CT scan. And with this program, we saw our lung cancer screening CT scans triple compared to what it normally is. So what this work has taught me is simple but profound. Equity isn't just about new programs or technology. It's about asking better questions and seeing who's missing. So for me, this isn't just data. This is personal, because these patients, they look like people in my own life. They look like me, my family members. So whether you're a non-smoker or a smoker, it doesn't matter. Whether you speak English or not, you deserve to be seen. I am Dr. Jeff Velotta, and this is my brief but impactful story.
Okay, we go to the next slide. Thanks. Okay, so that just brings home a little bit about it, right? It's not to confuse you, it's to tell you that we have 2 huge issues. We're going to talk about the first one, the former, which is lung cancer in people that don't have a smoking history, right? But we actually have another issue of the second part.
So maybe that's like part 2 next year. But we'll go with part 1 right now. And so we'll go to the next slide, please. So this is just something that we have to I needed to get in everybody's ingrained that lung cancer is very, very common. And it's the second most common cancer in men and women. And next slide. And if you go and you look, it's actually the #1 cancer. Next slide, please. It's the #1 cancer killer for both men and women. Next slide, please. So what's the issue? Why is lung cancer the #1 cancer killer in women? Okay, whether you're Asian, black, white, whatever. And you can see the majority, more than 50% of lung cancer is caught when it's stage 4. where the 5-year survival is, what, less than 10%. Only 24, 23% are caught early. We need to catch it early, right? What you heard on that video is lung cancer screening. But we know lung cancer in Asian women don't qualify for lung cancer screening. Next slide, please. So what is it? What you need to know first is this. Everybody still doesn't always get this. A lung cancer screening CT scan, right? It's similar to a mammogram, similar to a pap smear, similar to colorectal cancer screening, except it's a CT scan for the lung, not an X-ray, right? In China, a lot of people get X-rays. It's not the same. It's got to be a CT scan, but it's a 1-minute low-dose CT scan. Go ahead and play the slide, please. This is just one of my other patients, but all it is, this is what you can see. This is real time. Don't be scared of it. It only takes a minute long. It's literally minimal radiation. They are low-dose CT scans. You're not going to increase your risk of cancer. I have a lot of Asian patients that always ask me that, but that's all it is. But you can see up there, I'm not going to go over the criteria, but right now the only thing that's covered is if you're 50 and above and you have a smoking history. We know there are no guidelines for Asian women, Asian men that don't have a smoking history right now here in the United States. Next slide, please. So females, they're not decreasing in cancer. For lung cancer, it's dramatically decreasing in men, but it's not decreasing as much in women, okay? Next slide. And this is what we're seeing more, right? This is what we're seeing more. These are the women that we see more of, especially without lung cancer, especially without smoking history that have lung cancer. Next slide. Okay, so this is some of the research that we did, and you may say, this is just in Asia, or this is just Asian research, and it's not. No, this is here in Northern California. And for those of all of you that are Kaiser members, you could be in this study, right? We looked at all Northern California. And guess what? Lung cancer is actually more common in women, just in general. I consider when I talk to my patients, lung cancer is a disease of women. It's very rare to see it in men anymore, okay? So we know that, yeah, still 84.5%, right, are related to smoking. But about 15% are not related to smoking. Next slide, please. And if you look at the patients who don't smoke. Look what they're more likely to be. Asian, younger than 50, have a certain kind called adenocarcinoma. They almost always have adenocarcinoma. But this is the scary part, right? They're more likely to be diagnosed stage 4. Why? Because nobody knows about this phenomenon. Nobody knows that they're at risk. And they come in after symptoms, and they get denied, or you're just anxious. And there is no screening CT here in the United States. Next slide, please. So then you may say, oh, well, that's just at a point in time. For you, I know I've got a lot of researchers out there. For you epidemiologists out there, that was prevalent. So that's just like over a long period of time, just what's the issue with the cancer. But we looked at incidence. And this study just got published a couple years ago in CHEST, and all lung cancer this is again, all of Northern California. All lung cancer in Northern California, whether you're man, woman, smoking, not smoking, Latin, black, white, everything's decreasing. Lung cancer is going down, so people just assume it's gone. But in women, Asian, non-smoking women, lung cancer is increasing. This is the only study to show that it's increasing. But we need more of these studies, right? That's why, just my study's hidden in CHEST. But this is our population, right? San Francisco, Santa Clara has the highest amount of Asians. And so this is affecting us, and lung cancer is rising. Okay, next slide, please. So then you say, oh, well, right, this is just not a big deal, this non-smoking lung cancer, right? Well, we already know, I told you, worldwide lung cancer overall, right, including smoking-related lung cancer, is the #1 cancer killer. But look at the LCINS, lung cancer in never smokers. It is the 5th most common cancer killer worldwide, and when you include Asia, all of a sudden, lung cancer, the majority, 30% of lung cancer is now associated with non-smoking. Next slide. All right, so this is a little bit about, for those of you that know a little bit about just kind of the Asian American disparities and research, and I think this can hit home, and this is something that I'm trying to work on with you all in terms of cultural sensitivity, because obviously with me, I'm like just forceful a little bit, and we learned from Dr. Tai earlier today, there's a lot of things that we have to work on with that, with doctors. We can't do all that, but we know that cancer is the #1 cancer killer. Is the #1 killer in Asians. Or maybe we don't know that. I guess I'm already assuming you know that. Okay, so the most common cause of death in white people, Caucasians, heart disease. Most common cause of death in African American and black, heart disease. Most common cause of death in Latin, still heart disease. Most common cause of death in Asian Americans, cancer. Cancer, not heart disease. I know we all care about heart disease and hypertension and everything, it's cancer, okay? But why do we not get recognized for that? Why is there no cancer research? Because, I don't know, we'll just go over the model minority myth. And the model minority myth is that all of us in this room are pretty healthy, and everybody assumes that we're Asian and we're young and we have Asian don't raisin, and that we're gonna live forever, and that we don't get cancer, and that we're not sick, and that we don't need to study us, and we don't like to talk about it. And this is, I'm hoping this is going to hit home a little bit for you all. Susan Shinagawa, I don't know personally, she's a breast cancer survivor, but she says this perfectly, is that our problems never make the headlines, right? Asian people's cancer or Asian people's problems, right? Whether you're a celebrity or not, most of us are not celebrities, but either way, or even just lay people, it's not getting out there, our issues. We have to work on that. Next slide, please. So then if you say, well, what do you mean by Asian, right? Asian can mean a lot of things, South Asian, Chinese, Vietnamese, Filipino, Korean. But you look, even when you disaggregate, this is the only study to really disaggregate it, although we have one that's gonna be coming out soon, but disaggregation means by Chinese, Japanese, Filipino, whatnot. And look, for women, yeah, maybe it's not perfect where lungs are the #1 out of each cancer, but it's very high. And look at Chinese women, right? Look at Chinese women, it's lung by far. Okay, next slide. So this is the issue, lung cancer screening. The reason why I showed that video is because, yes, that second part of the video is about lung cancer screening in a smoking population with a 20-pack-year smoking history, right? But we know Asian women, in fact, if you poll Asian women in our Kaiser system, 95% of them don't have a significant enough smoking history or have been never smokers, right? It's culturally. Whereas our Asian men, I don't know if you know this, but our Chinese men in the Kaiser system, 50% have had a smoking history. It's a cultural thing, it's different. But these women, so even though we implemented lung cancer screening, you can see the way, all you need to take home from this slide is it doesn't affect Asians. So even if we screen, with the screening criteria that we have in the United States being a 20-pack-year smoking history or 50 to 80, it won't make a difference for the Asian women. It's not that it's wrong to get lung cancer screening, we still have to get it, but it's not gonna affect you all out here in the crowd. It's not gonna affect our family members. So what else can we do? Next slide. So we think, well, let's study it a little bit. And turns out we did study it. This is gonna come out this year, early in press. We know what the cause is, and for Dr. Pan and Dr. Tai, they know this, but for the rest of you, we know it's called biomarkers, because it's not necessarily genetic, but it's something in the tumor that Asian women get that don't smoke, and it's called EGFR. That's why I was talking to I can't remember, I was talking to so many people today, but another, about what was the biomarker status, right? What's the biomarker status? That's what you need to know. But most of our Asian patients don't know to even get biomarker status. When I just told you on the slide, 2/3 of them that get cancer will have EGFR biomarker status, which has life-saving, not only surgery, but targeted therapy just for your cancer. But how do you know if you don't get it? And how do you know if you don't get it for everybody, right? But we know that that's something behind it. Next slide. And then lastly, this is the biggest thing, and this is something that, that we think, or I think based on our research, the biggest risk factor for Asian women, right? It's not just every Asian woman is gonna be at risk, right? But Asian women specifically with a family history of lung cancer. And it doesn't matter in your family if they smoked or did smoke, and they're like, right, people, a lot of the Asian women that I talk to are like, well, yeah, my dad had it, but he was a big time smoker, and so that's why. No, it's more than just smoking. You have to get past lung cancer and smoking. The majority of people that smoke don't get lung cancer, okay? So anyways, it's a family history of lung cancer, regardless if they smoke. And guess what? If it's on your mom's side, so if your mom has it, then or your grandma has it, then there you go. It's gonna be a lot higher risk. So family history is a huge risk factor. Next slide. All right, so the take-home points is that cancer is the #1 cancer killer. So that's what we should be thinking about. And lung cancer, obviously, as we saw in Asian women, it is very, very high. We need to be screening family history women over the age of 50. That screening study will be starting soon, and I'll be screening 200 women for that. And you'll see, we're gonna see something, and hopefully that'll change policy. So until then, we just have to be proactive about your health, which is if you have a cough or any symptoms, you have to let us know. Or you go back, China, Taiwan, Hong Kong, Korea, Japan, they all do screening CT scans because they know this phenomenon. But we can't get this in the United States, so until then, you have to be proactive about your health. Next slide. And this is not another video, you don't need to hear me. No, it's okay, you don't have to hear me again. And then we're over time. So that is it, that's all I got, and thank you for your time.
Thank you so much, Dr. Velotta. Maybe you stay there. I have a lot of questions, so you're not going away without answering my question. Yeah, so give me a few minutes, I will explain to them. Yeah. 我想大家应该都听懂了哈。我本来是想说听懂的举手，我想大家都很谦虚，不会说。那我说没听懂的举手，更不敢说了。然后我那个横竖考虑了一个晚上，我觉得不管你听懂没听懂，我把我听懂的部分告诉大家。那 Dr. Velotta 呢，主要是讲了2部分的人，一部分呢就是Asian woman，American Asian woman non-smoker， 碰到的情况是怎么样？我们已经讲过了。现在这个是以2% 这个 increase rate every year 是非常，其实是非常 serious 的。然后呢，我在帮助宣传这个讲座的时候呢，我朋友就 came up to me 就说你可不可以问一下 Doctor， 我自己不抽烟，我先生也不抽烟，我们家也不烧饭，然后为什么我还 lifestyle 非常的 healthy， 为什么我会得癌症，而且我被查出来肺癌，一查就是4期，所以这真的是 very serious issue for us。另外一部分人呢，就是女性的是抽烟者，那他们呢有的时候也不能早期被诊断，为什么？他们不知道他们可以 qualify for lung cancer screening， 所以他们去查的时候也已经晚期了，这个就是非常可惜。我们有这样的好的服务，有这样好的渠道，但是他们不知道，所以 Dr. Velotta 今天来真的是很大、非常有意义的一件事情，告诉我们这2部分的人，虽然我们这个情况不一样，但是我们都可以做 early detection， 我们都可以来想到要预防。如果说你还有对其他的 table 什么有疑问或者想看更多的，就像我刚刚说的，我们在 YouTube 里面应该会放，可能给我们那个小唱一些时间，把这件事情做好。Okay, I just explained it to them. We are focusing on 2 groups of women, Asian women here. One is the one maybe majority are here non-smoker. And the other one is smoker, but they didn't know they qualified for early detection. That's why both of them end up late stage lung cancer. So for majority of us here, we sort of hit a wall. A friend came up to me after I sent them the flyer saying we're going to talk about it. And she said, I'm not a smoker. My husband is not a smoker. And we don't cook at home so much. And my family doctor told me I'm not qualified for lung cancer screening. And at the end of your speech, you mentioned something EGFR. So it's like a loop. Without a genetic test, you don't know if you have EGFR or not. And for qualify for that test, you have to be lung cancer. So it is something we hit a wall, we don't know what to do. Do you have any trick when we talk to our family physician so we can get a screen?
I do. I get this a lot now, actually, because I've actually given these talks all around Kaiser, and this is what they ask. So I don't recommend it for everybody, okay? So if you have a I do recommend it for people that have family history, okay? If you have a family history, you have to go with the most common risk, which is the highest risk, which is family history. So if you are, yes, indeed, an Asian female, but also the other thing is, don't try to get it if you're 20 or 30. The thing is, you'll be misguided. Most of the time, it's very rare to see it in your 20s or 30s, and if you do get it, as a screening test, even if it's negative, that doesn't mean it's negative, because usually they develop later. We saw in our research, normal lung cancer is in your 70s. Asian female lung cancer is in your 50s. So if you were in your 45, 60, it's really 50, that's why I'm cutting off at 50, that's the highest risk, 50 to 60. And this is all based off of studies in Taiwan, we know. So I'm not trying to reinvent the wheel, we're trying to pick the highest risk group. We know 50 and above, that's why in Taiwan they started at 55. So you go 50 and you have a family history, those I can convince now, even in the Kaiser system, where they're very strict, I can get those CT scans with the primary care doctors.
So I think it's family history. That's a big deal. If you have a family history, you should let us know now because I would be getting a CT scan if you're at that age group or right around that age group.
That is great. You answered that question. So we could get screened. No matter what FDA say, you're not qualified, you don't smoke a pack a day or something. We can search for help. Go to your family doctor if you have a family history. This one says, how many minutes do I have? 1? You steal all my time. Well, anyway, let me get the most important question within this 1 minute. You did a lot of work, showed a lot of things. Without all those numbers, figures, tables, it's nothing. But with all those, you don't even to speak. It's very clear that the trend of this lung cancer is 2% annually increased. So anyway, I'm not looking. I'm nearsighted. Okay, so I think it's very important. Your speech is very important. I do have many questions. So I would like to know if you would be interested in New Hope. We have a program called Meet with Shuming. Shuming is me. So periodically we will have seminars. It's interview based. You don't have to prepare all those. Just ask questions. So you're welcome. I invite you formally, officially today now.
Oh, thank you. I love that. I've already heard about it. I want to. Yeah.
So we're going to invite, or I at least will going to. We agreed, right? It's a deal.
Yes. No, I'm excited. I love it.
Yeah. So we would love to hear what you're doing, your progress, your project, your happiness, your stories, and also maybe your frustrations. Yeah, I want our voice to be heard by FDA, by professionals, so we can help ourselves and also help the whole world. It's actually not only in the United States, in England, China, Taiwan, everywhere. It's really an important issue for us. Okay, because the time is over, so you're welcome coming back, and we will schedule when you are less busy, maybe at the beginning of next year.
I can't wait. No, I appreciate it. I want to.
Perfect. Yeah, in that you should get ready to tell us. Now you are helping us to spread the word. Now I would like to know what we can do for you.
Well, this is the first word, is that we have to let everybody know, and we have to tell people that they need to come forward. If they do have a family history, they need to come forward if they have symptoms. A lot of these symptoms I didn't get into, but technically they usually start with a cough. It's almost always a cough in Asian women. They have this nagging cough, and it doesn't go away. We didn't have enough time, but my last video was gonna it was like an announcement to say what you do after a certain amount of time and after a certain amount of antibiotics and stuff. If you still have that cough, you need to let people know that you could be at risk. It's probably not gonna be lung cancer, but you still need to get checked out with an imaging test. So if you've had a cough for longer than 4 weeks and it's not going away with other things, that's something to think about. It may be nothing, but just get a little imaging test first to see. That's all I got.
Perfect. So we all know what to do, right? And for Dr. Velotta, I know you are going to airport, right? Thank you so much.
I can stay around for a little bit. My flight leaves at 6, so.
Thank you.
Thank you guys.